So first we want to do is hand hygiene, and then we want to make sure that the MAR and then the physician sheets order are matching. So patient's name, Maragamo Lucy, Fin 1 2 3 4 5 6 1 2 3 4 5 6 7 8 9 1 2 3 4 5 6 7 8 9. Date of birth February 16 1957, February 16 1957. And then physician is Dr. A. Wilson, Dr. A. Wilson. And then drug allergies, no known drug allergies, no known drug allergies. And then for the medication, Metropolo, 75 mg, PO, and BID. So that means twice per day. One we have scheduled at 8 o'clock, and the second one we have scheduled at 20 o'clock. Second one is furosemide, 40 mg, PO, and daily. So that's once per day. So that's scheduled at 8 o'clock. We have potassium chloride. It's an oral solution, and 30 MEQ, BID. So that's twice per day. So one is scheduled at 8 o'clock, and second is scheduled at 20 o'clock. And then last one is atorvastatin, 20 mg, PO, daily at bedtime. So this one's once per day, and it's daily at bedtime, so we schedule it at 20 o'clock. So the MAR sheet and the physician order sheet are matching, so we want to leave the physician sheet and then use our MAR. So we are going to prepare medications using our MAR. So first I just want to grab the medications. Okay. And then second, what we're going to do is we're going to review and check the medications. So we have Metropolo, and the expiry date is good. So I'm just going to put that. We have furosemide, expiry date, good. Then we have potassium chloride, and oral solution, and this one's oral solution, and then expiry date is good. Now that we checked our medications, we want to make tickets for the medications. So I'm just gonna grab a ticket here, and then first I'm gonna grab Metropolo. So I have Metropolo, oral. So I'm gonna write Metropolo. And then the dose would be 75 mg. And then the concentration, 50 mg per tablet. And then volume would be 75 divided by 50, so it would be 1.5 tablets. And then the date, so 30th of March 2021, my signature, and I also put my patient's initials on the top and the time that I'm gonna administer it. And we're just gonna leave this aside. Second one is furosemide, so I'm gonna check furosemide. I'll write it down. Dose is 40 milligrams, 40 mg, and then concentration is 20 mg per tablet. Okay, and then the 40 divided by 20 would be 2 tablets. So volume we need is 2 tablets, and then again the and then patient's initials. And the last one we have potassium chloride, and then oral. So I write potassium chloride. The dose for potassium chloride is 30 MEq, and volume or concentration first would be 40 MEq per 10 ml. So 30 divided by 40 times 10 would be 7.5 ml. And then we want to put the date and time, signature, patient's initials at the top, and then the time that we're going to administer. So now that I have made my label, I'm going to wash my hands and then do my patient's medications. So we want to begin with the first medication, which is metoprolol. Again, we want to double check. Metoprolol, 75 mg, concentration 50 mg per tablet. Okay, and we need 1.5 tablets. And as I said, before doing this, I did hand hygiene. So you put it on the lid and then put straight to the oral cups. And I'm just gonna put this away for now. I'm gonna grab furosemide. So furosemide, and 40 mg, 20 per tablet. So you need 2 tablets. Okay. And then put this aside. And then last one is potassium chloride, oral solution, potassium chloride, 30 MEq, 40 MEq per 10 ml. So we need 7.5. So we want to shake well first. And I'm just going to pour a little bit over 7.5. Want to grab a syringe and draw. And when you're putting the lid, you want to make sure that you're putting it on the side, not top like that. So want to draw a little bit over 7.5, so I'm gonna do 8. And I'm just gonna get rid of the bubbles. I'm gonna get rid of the excess. Okay. So that's 7.5 there. Okay, I'm just gonna put that, put this away. Okay, now we want to do a second check of our medication. So I'm gonna grab my first medication again, double check it. So I have metoprolol. We have metoprolol. It's PO, oral, BID, and the Dose is 75 mg. 75 mg. Concentrations 50 mg per tablet. 50 mg per tablet. So we would need 1.5 tablets overall. I have 1.5 tablets in there. Second one we have is furosemide. So we have furosemide, 40 mg, 40 mg, oral, 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 and then 2 tablets. The concentration is 20 mg per tablet, 20 mg per tablet, so we need 2 tablets. So I have 2 tablets in there. And the last one would be potassium chloride, oral solution, oral solution, oral solution. And then the dose is 30 MEQ, 30 MEQ. The concentration is 40 MEQ per 10 ml, 40 MEQ per 10 ml. And then volume is 7.5 ml. So we're gonna make sure we have 7.5 ml. We have 7.5. So now that I've prepared all my medication, I'm going to talk to my CEF to let them know what kind of drugs I'm going to give for my patient, as well as any assessments, what kind of assessment that I'm going to do, and any patient education that I'm going to do. So for metoprolol, this is a anti-hypertensive drugs, and the class is for beta blocker drug. This drug is for my patient's hypertension, and also because he had a history of cardiac failure, so it will help her for maintenance. Metoprolol is going to decrease the patient's BP. So possible side effects for metoprolol are insomnia. So since she is getting it twice a day, and the second one is close to bedtime, I should be aware of the insomnia effect. Another possible effect is hypotension, bronchospasm, bradycardia, dyspnea, dysrhythmia. So some assessment that I would do is to check patients' vital signs before and after administering, and I would mainly focus on the BP, pulse, and respiratory, because it affects this drug affects the SNS. I would also check for patients' health history and see if there's any interactions or contradictions for these drugs. So for example, the patient's going to take this drug with furosemide, and furosemide increase the effects of the metoprolol, so we have to be careful about that. And also we also have to be careful if the patient is taking any asthma inhalers, so it is important to check patients' health history. And also because of the orthostatic effect, it could affect hypotension, so I would advise the patient to get up slowly to prevent any falls, or let them know to ask for any help if they need any assistance. The second drug that we're giving is furosemide. So furosemide is a loop diuretic, and the reason why we're giving this is because of she is hypovolemia and she has a pedal edema. So what this medication is supposed to do is it will lower our patient's BP and increase her urinary output, as well as to help with her edema. So some of the side effects of this drug is hypotension, so we make sure again that we tell her to get up slowly, and also make the call bell in reach, so if she needs any help she can call us with the call bell. Another effect is hypokalemia and hyponatremia, so we want to make sure that we monitor the patient's electrolytes. We also have to monitor patient's kidney functions due to a renal failure side effect. We want to check if the patient is hydrated as well. And in severe scenarios, there could be ototoxicity. So maybe I would do like a base hearing test beforehand. Some additional nursing assessment is I would monitor for the potassium results, because as we saw, the patient's close to being hypokalemic, and her recent lab results showed that she's on the edge of 3.5 for her potassium value. So she's on that border. We also want to do vital signs before and after, and mainly focus on blood pressure and pulse. I would check patient's health history again, see if there's any interaction and contraindication for this drug. And I would also check if a patient is hydrated, because this drug results in high urine output. Check for patient's kidney and liver failure. I would also let the patient know that the drug could make them dizzy due to orthostatic hypotension again, so I would let them know that they have to get up slowly. And if the patient has to go to pee, I would make sure that the call bell is within reach. I would also monitor for the patient's weight to make sure that they're not dehydrated, and to keep track of their urinary input and output. And again, as I said, in severe scenario, there could be ototoxicity, so I would maybe get the patient's test the patient's hearing beforehand. And the last medicine that we're giving is potassium chloride. So the reason why I'm giving this to a patient is because of the adverse effect of hypokalemia due to furosemide. So furosemide is diuretic that is called K-wasting. So also we saw in the lab result that the patient is on the lower side of potassium level, so we want to make sure that she's getting enough potassium. The anticipated drug effect of this drug is to increase the patient's potassium level, and possible side effects is confusion, dysrhythmia, nausea, vomit, and cramps. And I would assess for this patient, I would assess for their vital signs before and after administration. I would also monitor for patients' electrolyte balances and make sure that they're getting enough potassium, as well as maintaining good balance. We want to also monitor for kidney functions. So those are what I would tell my CEF.